And then it's very important the topographical anatomy of the neck, because we can distinguish several triangles which are of importance in accessing pathologies in this area. And the sternocleidomastoid muscle is the most important structure in dividing the triangles of the neck, because it divides the anterolateral part of the neck in the anterior triangle and posterior triangle. The anterior triangle runs between the midline, mandible, and the anterior limit of the sternocleidomastoid muscle, and the posterior triangle between the clavicle, the posterior aspect of the sternocleidomastoid muscle, and the trapezius muscle. And also an important structure to know this anatomy is the hyoid. The hyoid divides the anterior triangle of the neck into, which are two compartments, the suprahyoid compartment and the infrahyoid compartment. The suprahyoid compartment is divided by the digastric muscle into two triangles. The submental triangle and the submandibular triangle. The omotracheal region or median cervical region, also called muscular triangle, is located between the omohyoid muscle, sternocleidomastoid muscle, which has been retracted laterally in this picture, and the midline. The jugular arch connects the anterior jugular veins on both sides. And the muscular triangle contains mainly the part of the infrahyoid muscles, and then the thyroid gland, trachea, and esophagus. And laterally, in the sternocleidomastoid region, which is below the sternocleidomastoid muscle, we can see the common carotid artery, the internal jugular vein, and a structure here crossing behind the carotid artery, which is the thoracic duct. The brachial plexus lies here in between the anterior and the middle scalenus muscle. And in this dissection, we retracted the omohyoid muscle and other infrahyoid muscles. We see the thyroid gland, the carotid artery, and the internal jugular vein, and the confluence between the subclavian vein and the internal jugular vein and the thoracic duct draining here. Of importance in surgery is that the brachiocephalic trunk, which gives the common carotid artery and the subclavian artery on the right side, can be higher in this place and be into this omotracheal region. So the posterior triangle, as we said before, is localized in between the clavicle, the posterior border of the sternocleidomastoid muscle, and the trapezius muscle. And in a lateral view, we see this posterior triangle. And the most important point of this triangle is what we call the Erb's point, that can be found approximately at half distance of the superior and inferior insertions of the sternocleidomastoid muscle. And Erb's point is important because the subcutaneous branches of the cervical plexus pierce the superficial layer of the cervical fascia, and they can be used. For instance, this is the greater auricular nerve that can be used as a neural graft. The transverse cervical nerves and the supraclavicular nerves, the lesser occipital nerve, and here, deep to it, the accessory nerve. In a closer view, we can see the accessory nerve here, supraclavicular nerves, and transverse cervical nerve and greater auricular nerves. So a lateral view of the carotid artery through the posterior triangle gives access as well to the carotid bifurcation